I want to talk about something that most people do not think of as metabolic issue. Stress. Not the dramatic kind, not a crisis. I'm talking about the low-grade, never-ending kind. The kind that comes from managing a career, a family, aging parents, financial pressures, and the constant feeling that there is not enough time. The kind that you have been carrying for so long that it feels normal now. Here is what I see in my practice. Patients who are doing the right things, they change their diet, they're exercising, and now they're sleeping better as well. But their blood sugar is still elevated. Their waist is still expanding. Their energy is still flat. And when we dig deeper, the missing piece is almost always stress. Not because stress is in your head, but because stress is in your bloodstream, your fat cells, and your hormones. I'm Dr. Handa, and this is Cognibios. And today we are going to follow the science from your brain to your belly fat and show you how exactly chronic stress drives metabolic disease and what the research says you can do about it. Let me explain what is actually happening in your body when stress becomes chronic. When you face a stressor, your brain activates the HPA axis, the hypothalamic pituitary adrenal axis. This triggers the release of hormone cortisol, your primary stress hormone. In the short term, this is protective. It raises blood sugar to give you energy, it sharpens your focus, and it mobilizes resources. But this system was designed for short-term threats. A predator, a conflict, a deadline. It was designed to turn on, do its job, and then turn off. But when stress becomes chronic, the system does not turn off, and the consequences are profound. Research shows that cortisol tells your liver to produce more glucose, raising your blood sugar even when you haven't eaten. It impairs insulin signaling, making your cells less responsive, and it activates fat storage pathways, specifically directing fat to your midsection and around your organs. A 2024 study from Rutgers University revealed something remarkable. In obesity, stress hormones effectively overwhelm insulin's ability to control blood sugar. The researchers described it as the stress hormones pushing the gas pedal harder, while insulin's braking effect stays the same. The result is a body that cannot regulate glucose, not because insulin is broken, but because stress hormones are overriding it. There is a direct link between stress and the belly fat. If you have noticed that your weight gain in midlife goes straight to your midsection, stress is likely a significant factor. And this is not just correlation. The mechanism is well documented. A study at Yale University found that even in non-overweight women, those who had greater cortisol reactivity to stress had more abdominal fat. They also reported more life stress, more negative moods, and performed worse on stressful tasks. The researchers concluded that cortisol causes fat to be stored centrally around the organs. And the study published in Psychoneuroendocrinology took this further. Among chronically stressed women, the combination of stress and highly palatable food, high sugar, high fat, was synergistic. Stressed women who ate comfort food had significantly greater abdominal fat, insulin resistance, and oxidative stress than non-stressed women eating the same foods. Read that again. The same food produced worse metabolic outcomes in stressed women. Stress was not just adding to the problem, it was multiplying it. The mechanism involves neuropeptide Y, released from the nerve terminals in visceral fat tissue under chronic stress, which directly stimulates fat cell growth. And here's why this matters, especially in midlife. Your HPA axis, as we discussed before, the stress response system changes with chronic activation. Research shows that prolonged stress causes your adrenal glands to physically grow, altering how they produce cortisol. And when the stress finally eases, recovery takes weeks, not days. Worse, chronic stress makes the system less resilient to future stress. Each prolonged stressor leaves your stress response a little more dysregulated. Cortisol the anabolic-catabolic balance shifts. Cortisol stays stable or rises while anabolic hormones like testosterone and DHEA decline. This imbalance promotes sarcopenia, visceral fat accumulation, and insulin resistance, the exact cluster we call metabolic syndrome. In midlife, you are also more likely to be the caregiver, whether for children, aging parents, or both. You are navigating career pressures, financial stress, relationship changes. The chronic stress load in this period of life is objectively higher than at any other time, and your body is paying for it metabolically. Well, I'm not going to tell you, just relax. That advice has never helped anyone. Instead, let me share what the evidence shows actually changes your cortisol levels and your metabolic outcomes. A randomized clinical trial found that 8 weeks of mindfulness program reduces hair cortisol, the most reliable biomarker of chronic stress. The intervention reduced the risk of worsening cortisol level by 88%. Perceived stress dropped by 54%, and anxiety symptoms decreased by 50%. This is not about sitting in silence for an hour. This is about structural practices, 15 to 20 minutes a day, that measurably change your stress physiology. Guided meditation, body scans, breathing exercises, the evidence is clear. Next, I'm going to talk about movement as stress medicine. Exercise is one of the most potent cortisol regulators we have, but the type matters. In the context of chronic stress, moderate intensity movement, walking, swimming, cycling, yoga is more effective than high intensity training, which can actually elevate cortisol further in already stressed individuals. Aim for 150 minutes per week of movement that feels restorative, not punishing. This is not about burning calories, it's about resetting your nervous system. Another important factor is social connection. Stress does not just affect individuals, it thrives in isolation. Research consistently shows that strong social connections buffer the effects of stress on the HPA axis. People with healthy social networks have lower blood pressure, better cortisol regulation, and reduced metabolic risk. This is why social connection is one of the 6 pillars of lifestyle medicine. It is not a soft recommendation, it is a biological intervention. Finally, and I say this as a physician, some of the stress in your life is modifiable, not all of it, but some. Saying no more often, setting boundaries with work, asking for help. These are not indulgences. When chronic stress is driving metabolic disease, reducing the source is a medical intervention. So if you have been doing everything right with food, exercise, and still not seeing the results, I want you to honestly assess your stress levels. Not as a character flaw, not as something you should just handle better, but as a biological force that is changing your hormones, redirecting your fat storage, and undermining your insulin function. The science is unequivocal. Chronic stress is a metabolic disease driver, and addressing it is not optional. It is essential. In the next episode, we are diving into food as medicine, what the research shows about nutrition patterns that prevent and reverse chronic disease without deprivation, without extreme diets, and why the food as medicine approach is more powerful than any supplement on the market. Subscribe, turn on notifications, and if this resonated with you, share it with someone who carries stress the way so many of us do in midlife. They deserve to understand what is happening inside their body. I'll see you in the next one. Bye.